Okay, so now we're going to move on to our second PowerPoint for week 2. We're going to talk a little bit about interprofessional education. First, let's kind of review the objectives for this part of the presentation. We're going to define what IPE is. We're going to list the core competencies, and we're going to discuss the role of IPE in healthcare and how we use it here at the school for this program and the School of Health Professions. Here's a working definition from the World Health Organization. Occurs when two or more professions, whether they're students, residents, or other healthcare workers, learn with, about, and from each other to enable effective collaboration and improve health outcomes. So next we're going to look at the core competencies that are defined by the Interprofessional Education Collaborative, which is also known as IPEC. Here are the core values that defined by IPEC. The first one is values and ethics, the roles and responsibilities, teams and teamwork, and communication. And remember what the definition of IPE is, where we're going to work together to learn with, about each other to improve patient outcomes. So the role in healthcare education, primarily the overarching goal is that we want to provide patient-centered care and to improve patient outcomes. That means patient-centered care means the patient, we're always concerned about the patient. Whatever we do, the patient is center of all decisions that we make. And what happens is we actually improve their outcomes. And when we look at this also, joint decision making after completing an individual assessment of the patient. So in the clinical field, I would do my role to evaluate this patient in terms of respiratory needs, and then we would go to the team, which would be the nurse and the doctor, maybe even speech therapy, physical therapy, occupational therapy, case manager. So we're going to come up with a joint decision together. So the last thing we're going to look at today in this presentation is what's the process? How do we do this at CCBC, and how do we do this in the program? So we use a lot of simulations. CCB has several simulation rooms. We have simulation rooms on the Essex campus, the Catonsville campus, and the Dundalk campus that we're able to use. And plus our program itself has 2 simulation rooms in the lab, and there is a control room in between the 2 spaces. We assign interprofessional teams in terms that, I get together with the faculty members of the programs that we're going to work with. We try to limit that to 2 to 3 programs because it gets really, really difficult to handle more than 2 or 3 programs. The faculty develop the scenario, whatever the scenario is, whether the topic is for that particular IPE event. We divide the students in the programs into groups. We provide them with instructions on what the scenario is. We give them some guidelines, and then we assign students roles. And one of those roles is a student is the recorder, where the student kind of takes notes of what's happening. The students actually complete the scenario. They run through it. The scenarios we keep kind of short, no more than 10 minutes or so that, there is learning going on. And once we're done the scenario, everybody debriefs. The group gets back together. They discuss on what happened. They have a reflection process as a group. What did they do good? What did they do bad? What could have they done better? How could they improve? And then also students have an individual time to reflect. What personally could they done better? And what take-home message are they going to use and incorporate in their actual clinical practice?